Since I stood in front of you about a week ago, the situation in our province has continued to evolve, underscoring the importance of continued efforts by Albertans to protect themselves and the health system from the Omicron variant that is moving rapidly all around the world. Our active cases have gone from about 4,000 on December 14th to 6,000 yesterday. Our positivity rate, which has been at or below 3% for most of the month, has begun to climb in recent days and is now at 11%. We've also seen a rise in the number of confirmed Omicron cases in the province, and the proportion of total cases identified as the new variant is growing quickly. Between the 3rd and 9th of December, it represented just 1% of all cases. Between the 10th and 16th of December, about 22% of all new cases in Alberta were Omicron. And between December 16th and 18th, Omicron represented roughly 52% of all cases. Now, as I said last week, there are still many unknowns about this variant, and we continue to very closely study the emerging data around the world. But what we do know is that this variant is more transmissible than any previous strain of the COVID-19 virus. That is why we've already taken steps to protect Albertans, including expanding the eligibility of booster doses to all healthcare workers and everyone 50 years of age and older, as well as making more than 2.5 million rapid tests available for free across the province. Altogether, we've distributed since the beginning over 8.5 million rapid tests. But more must be done urgently to protect our healthcare system from the potential threat of Omicron. First, as announced this morning, we've opened up booster doses to anyone 18 years of age or older who had their second dose at least 5 months ago. Now, let me be clear. Getting a booster dose is the single most important thing that you can do. So if it's been at least 5 months since your last dose, book your booster right now. While we were originally aiming for the 6-month interval to provide longer-term protection, we are making the strategic decision to move up these doses to protect Albertans urgently, given the rapid spread of Omicron. This comes at the recommendation of our Chief Medical Officer of Health, as evidence becomes available about the potential for reinfection in those who have had previous strains of COVID and breakthrough infections in those vaccinated with 1 or 2 doses. Whether you were previously infected with COVID-19 or you've had 0, 1, or 2 previous doses, we're urging every Albertan to get whatever vaccine they're eligible for as soon as they possibly can. This will help to keep you and those you love safe. It'll also help to protect our hospitals from being overstressed again. And we are going to move heaven and earth to get as many booster shots to Albertans as possible. We'll be expanding the number of sites available to administer vaccines across the province and working with both local community groups and large employers to make boosters as convenient as possible. We are appealing to Albertans to reduce their number of daily in-person contacts by half over the coming weeks. These new measures in large public settings will help, but we also need Albertans to make personal choices in their daily lives that will slow transmission.